My name is Sharmila Patel. I'm an audiological scientist and I work at the Auditory Implant Programme at St George's Hospital. The role of the audiological scientist or the audiologist is to provide information on the patient's hearing ability, and they will do that by conducting what we call a pure tone audiogram, which is a hearing test, and it will describe the different pitches of sounds and the level at which the patient can hear those. And depending on the hearing loss, the degree can vary between mild hearing loss to profound hearing loss. Typically in a week, myself and my colleagues will see anywhere between 5 to 10 patients. When patients come to the auditory implant team, they have several options available to them, which include middle ear implants, bone conduction implants, and cochlear implants. Middle ear implants are suitable for patients who have a conductive, mixed or sensorineural hearing loss. The device is designed to relay natural sounds via vibrations of the middle ear bones, and it's particularly suitable for patients who are unable to wear hearing aids due to a medical condition. A bone conduction implant is an implant that is suitable for patients who have a conductive or mixed hearing loss. And the device is designed to directly stimulate the inner ear. Cochlear implants are an option for patients with a severe to profound deafness who are not getting adequate benefit from their hearing aids. So patients who have hearing aids that are the most powerful that are available for their type of hearing loss, but they're still struggling to hear sounds. The assessment for an auditory implant involves a number of appointments which will occur over a few months and will involve being seen by a multidisciplinary team which will be made up of various professionals to include doctors, surgeons, audiologists, speech and language therapists, hearing therapists, as well as a radiology team. Within the UK, there are currently over 10 million people with some degree of hearing loss, and with an ageing population, this number is due to rise. That equates to 1 in 5 people with some form of hearing loss in the UK, and evidence shows that on average people take between 7 and 10 years before they seek assistance for their hearing loss. If you or your family member feel you have a hearing loss, these are commonly identified by everyday listening experiences. You may not be able to hear on the phone, you may need to ask people to repeat what they're saying, you may not hear any of the conversation that is occurring, and you may not be aware of environmental sounds. If you feel that you answer yes to most of these, then it would be beneficial for you to have your hearing assessed. You could talk to your GP about this, who would refer you to your local audiology team for an assessment, and this will allow you to have all the information required to make an informed decision regarding a device that would help you hear better.